Morning, Jen. My name is Windsor, and I'm your athletic therapist today. And I'm going to break down your plan of care for your TFCC injury. So you're going to see me for 50 minutes each time for 3 times weekly for the first 3 weeks. Then twice a week for the next 3 weeks, just for monitoring your symptoms, make sure there's nothing that occurs. So it's going to be a total of 6 weeks. And for the first week, since you don't have instability in your wrist, which is a very good sign, that means you don't need surgery. And you're just going to undergo 1 week of rest with splinting. So the splint, simply place your hand inside and with the thumb portion going out here and wrap it inside. There you go. Yep, perfect. And you're going to keep that on for the week, the duration of the week. So this will prevent scar tissue breakdown, scar tissue breakdown. So it promotes healing by allowing scar tissue to form. So second week will be doing joint mobilizations to increase ulnar deviation. And we're going to perform maintenance grade 1 and 2. So we're going to just slightly move your wrist in the direction that we want to gain. So that will just reduce pain and allow the pain to subside. So maintenance grade 3 and 4 is going to be our next progression. So a little more through the range of motion to like the end range, if you're able to tolerate it. That will allow even more range of motion for us to be gained. So this is just to maintain mobility of the soft tissue, ligaments, tendons, muscles, and prevent scar adhesion from forming. And we are going to do it for about 1 to 2 minutes. And we're going to do the transverse friction massage as well on the ligament that we suspect to be injured. And we're going to do that for about 1 to 2 minutes. And that's also to prevent scar adhesions and maintain mobility. And then we're going to perform general mobility exercises. These are all within the second week. So this is wrist rotations. This will be horizontal ulnar and radial deviation. And it will be active pronation and supination. So pronation, supination, and stretching, flexion, and extension of the wrist. The exercises will be 15 reps, 3 sets each. And these are performed once you remove your splint. So basically when the second week treatment starts, you're going to perform these exercises. And make sure if there's any pain, let me know. And ideally the last rep should have more range of motion since you're flossing the movement and increasing your range of motion. For the third week, we're going to focus mainly on strength. And you're going to start off with first session with holding the isometric contraction. And you're going to hold a 5-pound dumbbell. And you're going to do this for about 30 seconds to a minute. And then we're going to work on your concentric. And we're going to work on all osteokinematic ranges of motion. So that will be flexion, extension, and pronation, supination. And we're going to start off conservatively with 2.5 pounds of resistance. And we're going to do that concentrically first. Then we're going to progress based on how much you can tolerate. We're also going to do ulnar and radial deviation with the weights. And there'll be about 12 to 15 reps, 3 sets. And you're going to finish this ideally within 3 weeks. So we're going to hopefully achieve about 80% of baseline strength or whatever your unaffected side strength is. Then we're going to do wrist taping so you can get back on the court, right? And hopefully get the practice that you wanted to get in so you can get your groove back and come playoff time, you're ready and rolling. So we're going to do this prior to the game or practice just to make sure it's stabilized and make sure that there's no unnecessary range of motion that we're hitting that we don't want to hit. So let me know if there's any recurring symptoms, any pain, any weakness, tingling, burning pain, and any of that. at the end of each week, we're going to have you fill out a questionnaire about your symptoms to see how you're doing. So do you have any questions?
Yeah. So do I have to wait like a whole 6 weeks to return to play? Is that like a...
Thankfully, your injury is not that serious, so most probably within the month you should be good. Within 3 weeks, hopefully. The 4 to 6 week range is just for me to check on your symptoms. Hopefully, there's none that occurs, but aside from that, and obviously make sure to follow my instructions. Make sure to come in for your weekly clinic sessions, and that way we're really able to make sure your progression is going to be speedy and fast. All right. So you got everything.
Yeah,
sounds good to go. Perfect. All right. I'll see you again.
See you.